Greetings from Nairobi, Kenya. This is your favorite journalist, Terry Wangari, reporting for Africa Diaspora News Channel, bringing you factual news content from the continent and beyond. Now, when innovation meets resistance, hope collides with history, and health meets sovereignty. Across Africa, as new health breakthroughs emerge, they bring stories of empowerment and echoes of the past that can't be ignored. The Bill and Melinda Gates Foundation is rolling out something unprecedented, a world-first, long-acting contraceptive launching in Africa later this year, starting in Kenya.
When we do something in Africa, we do it in Kenya first. And there's a reason for that. It's because of our shared interests and alignment on governance, on rule of law, and democracy.
This groundbreaking tool combines a hormonal IUD effective for up to 8 years, designed to be affordable and discreet, overcoming cost and stigma barriers, and a self-administered contraceptive patch embedded with microneedles that delivers protection for 6 months with just a touch. Simple, private, and powerful. Now, this initiative is part of a sweeping $2.5 billion commitment to accelerate women's health innovation across the continent, with targeted rollouts in Kenya, Nigeria, and potentially India. It aims to give women control over their protective futures. But not everyone welcomes innovation unservedly. In a bold move, Namibia's President Netumbo Nandi-Ndaitwah decisively rejected a proposed trial of this long-term IUD in her country. Her message was clear: our people are not experiments. With just over 3 million citizens, Namibia sees little logic in targeting its population for control measures, especially when more populous countries like the US face growth concerns. She framed it as an issue of dignity, autonomy, and national sovereignty.
The president of Namibia, whose name I have written because I do not want to mispronounce, her name is Netumbo Nandi-Ndaitwah. She said, no, it's not going to happen, not in my country.
This rejection didn't come from ignorance. It came from conviction, a powerful assertion that innovation must still respect consent, context, and the will of communities it intends to serve. Now let's turn back the clock a little bit. Polio was once a scourge feared across the globe. In 2016, a monumental public health decision was made to switch from the standard polio vaccine to a version that excluded type 2 poliovirus, aiming to eliminate the risk of vaccine-driven outbreaks. But the outcome was devastating. Instead of decline, vaccine-deprived type 2 poliovirus surged, paralyzing over 3,300 children and costing over $1.8 billion to contain, mostly across Africa. A blunt draft report deemed the switch an unqualified failure, pointing to leadership blind spots and delayed response mechanisms. Experts warn it would be better to take the time, get it right, than to rush and fail spectacularly. Now, polio hasn't been beaten yet. In hotspots like Afghanistan and Pakistan, where the virus still lingers, there are deepening cracks in the system. A recent AP investigation exposed systematic failures such as fake vaccination records, undertrained staff, broken cold chains, and even underage volunteers in the field. The oral vaccine, while successful in the past, carries rare but real risks. It can mutate and spark new outbreaks in areas with low immunity. Alternatives like the injectable vaccine are safer but costlier and less accessible. So the lessons here are clear. Even the best intended health policies can fail if trust, oversight, and context are ignored. So here's the paradox. The Gates Foundation's new contraceptive tools promise access, empowerment, and equity. But history reminds us that without trust and transparency and consent, even innovations become entangled in controversy. Namibia's rejection signals something crucial. Effective health solutions must engage local perspectives not replace them. Meanwhile, the polio saga teaches us that haste and hubris can lead to harm even in the name of progress. Now, real success lies at the intersection of creativity and community ownership. As Africa strives toward better health solutions, we stand at a crossroads. Innovation must be met with introspection. Policies need partners, not enforcers, and trials require trust. And progress must be measured by empowerment and not imposition. If women in Kenya or Nigeria gain autonomy through affordable long-term contraceptives, that's transformation. But only if these tools are offered with respect, rooted in consent, and forged in collaboration. We need to keep watching closely, demand accountability, advocate boldly, because health isn't just about cures. It's about communities, choices, and dignity. Thanks for watching, and please remember to subscribe, like, and share this video. Feel free to leave a message on the comments section on what you think about this move to introduce the 8-year contraceptive in Africa. And remember, stay curious, stay critical.